Hey guys, so in today's video, I'm back with placenta's sonographic features from the book Requisite or Ultrasound. So first I'll talk about the thickness of placenta. The normal thickness of placenta is between 2 to 4 centimeters. If the placenta is thick, it is greater than 4 centimeters, and if it's thin, it's less than 2 centimeters. The thick placenta differential diagnosis is gestational diabetes, hydrops infection, maternal anemia, intraplacental hemorrhage, placental mass, placenta accreta, gestational trophoblastic disease, triploidy, and Beckwith-Wiedemann syndrome. The thin placenta differential diagnosis is incident-dependent diabetes, chronic hypertension, and marked polyhydramnios causing stretching and compression of the placenta. Over here in this picture, there is circumferential echogenic foci, which denotes placental calcification. It is of no clinical significance. In these two pictures, we learn the correct placement of calipers for placental measurement. The placenta should be in the long axis, and the calipers should be placed perpendicular to the long axis. Over here, the placenta is obliquely placed, and the calipers are not perpendicular to the placenta. So the measurement over here is greater. It is 4.8 here and 3.2. So 3.2 is correct. Over here we have two thick placentas. This one is due to gestational diabetes, and this one over here is due to the parvovirus infection. Over here you can also see hydrops. So in the next page we have a very thin placenta. This is due to severe polyhydramnios. Transverse image of the uterus during the third trimester shows a thin appearing placenta and large amount of amniotic fluid. The placenta is thin because it is stretched and compressed along the inner surface of the uterus by severe polyhydramnios. Over here we have the succensurate lobe of the placenta. So basically, when the succensurate lobe is a bilobe placenta in which there is no connection. So this is the main lobe and this is the succensurate lobe. How do we know which one is the main lobe? Basically, the umbilical vessels would go towards the main lobe and not towards the succensurate lobe. So I will read the description over here. Succensurate lobe of the placenta. A longitudinal grayscale image of the uterus shows two separate placental lobes. The main lobe M is located anteriorly and the succensurate lobe is located posteriorly. Over here, the oblique image of the uterus with color Doppler in the same patient as in A shows that the umbilical cord insertion towards the main lobe. It is inserting into the main lobe. And in C, the transverse image of the left lateral portion of the uterus with color Doppler shows blood vessels traveling from the main lobe of the placenta posteriorly towards the succensurate lobe. The vessels, they are going from the main lobe towards the succensurate lobe. Thank you.